the President of the Republic of Kenya, who is also our country's Chief Vision Officer, His Excellency Dr. William Ruto, the Deputy President, His Excellency Gachagua, the Second Lady, the Prime Cabinet Secretary, colleague Cabinet Secretaries present, Excellency Governors present, Principal Secretaries present, elected and honorable members, to our Healthcare Foundation and AMI, the community health promoters. Afya yetu, jukumu letu. Asante sana. Your Excellency, this is a momentous occasion as we live up to the promise in the Kenya Kwanza plan. The flagging off of our community health promoters kit is the actualization of a cherished vision, a vision that resonates with the ideals of universal health coverage and community well-being. We will only achieve UHC through strengthening primary health care, afya mashinani, and empowering community health services, which we rightly call afya nyumbani. As a ministry, we aim to promote health and prevent diseases rather than fighting them, which will in turn address the increasing healthcare costs. The shift from curative to preventive and promotive care is not only a smart investment, but also a guarantee massive healthcare improvements across the 47 counties. Many countries around the world have recognized the significance of strong primary healthcare systems. Countries like Mexico, Brazil, Bangladesh, Thailand, and Korea have made remarkable progress in expanding access to healthcare through community health workers. They serve as examples, Your Excellency, that we model and align with our Afya Nyumbani initiative. And I thank you, Your Excellency, for the opportunity to be at Harvard 2 weeks ago to meet with the ministers of these countries. As a ministry, our mission is to ensure we build a healthier, more resilient Kenya. This commitment rings true in Kajiado as it does in Kacheliba. This commitment is true in Homa Bay as it is in Elgeyo Marakwet and in Nyeri County. These kits today, Your Excellency, will go to alleviate the health burdens in Trans Nzoia County as they will in Tana River County, to improve wellness in Laikipia, Loichogio, and Lamu. We hope that they will help Kenyans to receive early diagnostic and referral care from the comfort of their homes and villages nationwide. Your Excellency, community health services stems from the inherent right of every Kenyan to access quality and affordable health care. It is a demonstration of active pursuit of a healthier nation. With an estimated 10 million households, our strategy for outreach is to leave no one behind. To ensure that we understand this, allow me, Your Excellency, to help all those who are slow learners like myself and have difficulty with numbers and figures, except when they are dealing with money, Your Excellency. Most people, when there is a 10-cent reduction in their M-Pesa, and the CEO of Safaricom is here, will tell you, they will know Safaricom imekata shilingi zangu 10. But in this case, Your Excellency, 10 community health promoters, each is tasked with 100 households. That means 1,000 households, Your Excellency, form one community health unit, which we call the CHU. And this CHU, Your Excellency, is headed by a community health assistant that we refer to as the CHA. This will establish approximately 10,000 community health units in the country. These units are the bigger part of a larger primary care network, PCN. This means that each unit is linked to a specific level 2 health facility, commonly known as dispensary, and a level 3, commonly known as a health center. These facilities are mapped to level 4 facilities, such as sub-county or county hospitals, and we are creating a hub and spoke model where the level 4 facilities serve as the central point. Your Excellency, I would like to thank you most sincerely for the pressure that you mounted on me, the continued support and leadership that you have given to the health sector as one of your key priority agenda. Many times I met Senator Aaron Cheruyot, and he asked me, in 100 days, kila mtu atakuwa na afya. Today I'm proud that we begin this process. I want to thank our governors. Thank you for honoring our invite. You are the custodians for the primary healthcare agenda. I acknowledge and laud your immense collaboration and goodwill as we continue together. Asanteni sana. But please note, we are in this together, let's do it. To the health committees in both houses, your support by running checks and balances at Ministry of Health in delivering UHC cannot be underestimated, especially now as you midwife the new bills into acts of parliament that shall form the governance structure for UHC. As a ministry, I want to thank the partners who have worked with us. I want to acknowledge CIF, to acknowledge World Bank, to acknowledge CDC, UNICEF, AMREF, PATH, WHO, USAID, Safaricom, and all the development partners for the immense support. Your Excellency, I have two very hard-working principal secretaries. I truly want to acknowledge them today for the work they have done. PS Mary Mudhoni, PS Harry Kimtai, asanteni sana. Your Excellency, allow me to single out Dr. Maureen Kimani and Dr. Salim Hussein, who have been globally recognized for their efforts in community health. In Dr. Salim's word, Your Excellency, today feels like his wedding day. Asante sana, Your Excellency. And lastly, thank you to my chief advisor, my technical advisor, the Director General, Dr. Amoth, and the entire team of Ministry of Health who are looking at us across our headquarters. Asanteni sana, team. Your Excellency, now I would like to recognize our cherished women and mothers across the country, who by default are the first doctors and nurses and clinicians when a family member falls sick. I honor their involvement in the day-to-day attempt to provide healthcare at home. As a fellow mother, and our second lady is here with me today, we'll agree that mothers are the bedrock of community health promotion, and we'll involve them as much as possible in Afya Nyumbani together with our community health promoters. Your Excellency will agree that if you are at home and you started to cough, I'm sure your mother will stand with either a fist at your back just to check what's wrong with his son. And I'm sure Mama Rachel will ask, do you need some hot water with honey or with lemon? Your Excellency, that is what mothers are. We are born inherently as doctors. As I conclude, let me remind the country that the theme for this year's Mashujaa Day celebration is universal health coverage, and the celebration will run from 13th to 20th October. Allow me to welcome you all to the green and splendid county of Kericho for our celebrations and the launch of the UHC program that shall be graced by His Excellency the President. Kenyans, together we can make quality healthcare accessible to every household, every individual, and a secure, brighter, healthier future Kenya lies ahead of us under His Excellency, the President of the Republic of Kenya, William Samoei Ruto. Asanteni sana. Your Excellency, I want to take this opportunity to now invite the Prime Cabinet Secretary